So firstly, we're joined by so many people that I have learned from over the years as a professional. And from the Department of Health, Marita Kinsella, we're delighted to have Marita. She's our Chief Pharmacist, and her colleague Lucia Crimmin. Also, our colleagues, a really warm welcome from the PSI, including Ciara McGoldrick, our Registrar, Paul Fahy, our President, and members of Council. Also to our colleagues from the Irish Medicines Board and from the Irish Pharmacy Union. And we're also delighted to have loads of pharmacists with us from both the community sector and the hospital sector. And we have Mary Rose and Joanne, both from Boots and Unicare Docmara, superintendents of the largest chains in Ireland. So we're delighted for their support. I'll keep the speeches short. So we have two wonderful ladies to speak after myself. I'm just up here to do the thank yous, and thank you to everyone that has got us this far as a company, without whose support we wouldn't be here at all. Basically, Pharmapod, well, we're a software development company, and this evening we're launching a cloud-based platform specifically designed for pharmacists. Now, Pharmapod are based at the NDRC, which is the National Digital Research Centre. Ben, the CEO of the NDRC, he's such a busy man. He was here until about 5 minutes ago. We got a picture with him, but he's scooted off. But we're sincerely grateful for the continued support given by the NDRC. For a startup company, I think the most difficult challenge is to be on your own, and the feeling of isolation, trying to bring an idea to fruition. But we didn't have that challenge as a company, because we were supported and we had the solidarity of all the other companies within that centre. And, you know, brilliant, hard-working young entrepreneurs. It's a very positive environment, and it's generating a lot of employment as well. So thank you to the NDRC for being a catalyst for that. So the solution we're launching this evening is Ireland's first national incident management and learning system for pharmacists. And in summary, the system allows pharmacists to manage and report the incidents that occur with medication in their practice. And that learning is then shared with other pharmacists across the country. Well, why is it needed? After you hear from both Margaret and Mary, you'll be in no doubt as to why this product is an absolutely vital one to have in the market. But just a few medication-related statistics for you. Medication side effects are the 5th most common cause of hospital deaths, and 197,000 deaths per year in the EU are related to adverse drug reactions at a society cost of €79 billion. So our system aims to reduce the medication-related incidents across the pharmacy sector, and also to reduce the morbidity associated with it, both for patients and the cost for society also. So we help pharmacists manage their incidents, carry out root cause analysis, and as well as that, plan their corrective action, so you prevent the errors from recurring. And that's the most important thing, because reporting for reporting's sake is a wasted opportunity. So there's lots of added value for pharmacists. Essentially, it's a legal obligation for pharmacists to carry out such activity anyway, but now they finally have the system to do that. We have also a support service for pharmacists, and so pharmacists can ring us up. We have manned telephone lines from 9 to 5, so if you need any technical support on that, we have a lot of resources. The user guide is more like a training guide, so it's an information piece. Tony?
You good then? Okay.
Yeah, brilliant. But importantly, we've partnered with IACME, which is the Irish Academy of Continuing Medical Education, and Caroline, that was given a demo tonight, is from IACME. They have, so we'll be delivering sound bites of CPD for pharmacists on a regular basis relating to incidents and error management. IACME already have the European accreditation and have developed a 3-hour module for GPs in relation to adverse drug reactions here in Ireland. Our aim is to work closely with the current software providers in the pharmacy sector to create a comprehensive solution to fully meet the pharmacist's professional needs. And we've been very well supported by people in the industry such as McLernan's, and we look forward to continued discussion with those software providers. And we're also very happy, and we're delighted to have some colleagues from the Irish Medicines Board. Niamh, thank you for coming along tonight. And we're embarking on a separate testing phase with the Irish Medicines Board, whereby pharmacists can report adverse drug reactions and quality defects straight from the Pharmapod system directly into the Irish Medicines Board systems. So we'd like to hear from any pharmacists interested in taking part in this testing phase, but obviously until that phase is finished and we have further notification, then we continue to report to the IMB through the regular channels. We've also scoped out future modules, so next year we'll be offering a complete suite of quality assurance documentation, pharmacy practice procedures, policies and audits, as well as well, again, these are required by law. Our aim is to provide a very smart IT system. For example, when a pharmacist learns something from the incident management system, then that can populate into their e-portfolio in relation to CPD. And we hope to work closely with the new Institute of Pharmacy when it's fully embedded here in the RCSI to ensure that systems are interoperable and that there's no duplication of entry on the part of the pharmacist. I'd also take this opportunity to thank our advisors that are here tonight, Mary Rose Burke and Jim Canavan and Dr. Mark Ledwidge, for the valuable time and support and encouragement that they've given to a startup enterprise. It's very easy to support a large company that's doing really well and up on its feet, but it's really much appreciated in a company of our position. And finally, I have to thank our team for all their effort and hard work for us to get here this evening. So Tony, our fantastic CTO, who I think is definitely the most patient man in Ireland, and he just happens to be English. But Tony can answer all the technical questions that you may have tonight in relation to the system security and information security, etc. A huge thanks to Paul and Gavin for leading on the development of the system itself. Thank you very much. And Oisín, who's on technical support and development for Pharmapod. Jesus, our designer at Pharmapod, not only an amazing designer, but an absolute pleasure to work on a daily basis. And we've worked so hard over the last few weeks, but there's been a lot of laughter as well at the Pharmapod desk. So it's been great and it's a real pleasure. Also to Rebecca, who was with me when the Pharmapod logo was just a scribble on a napkin. Becky's here tonight. And Mary, who you met at registration, and to dear Roisin, who also works with us because she's one of my dearest friends and her support means the world to me. So thanks again everyone for coming out tonight. I'll leave you with a short clip that myself and Jesus put together on Friday because it can actually probably sum up better what Pharmapod is all about. It's very hard to say it in words. And then I'll introduce our two wonderful speakers.